Today I will be talking about the bronchopulmonary segments. Now, the right lung is divided by the horizontal fissure, the oblique fissure. The horizontal fissure divides the superior lobe and the middle lobe, and the oblique fissure, which also is present in the left lung, divides into superior lobe and the inferior lobe in both the lungs. Now, the superior lobe has this apical segment. Now, apical segment with the name itself is the topmost position. So, apical is clear. Now, anterior and the posterior, we have to remember that we are viewing this from the costal aspect. So, the person, let's say, of the right, while we are talking about the right lung, is looking at the east. If I have to tell in this way, I have drawn a compass. The person is imagined to look at the east, so I can visualize from the right lateral aspect of the lung. So, this automatically becomes the anterior. If the person has this face this side, so this becomes the anterior of his chest, anterior, and if the person is looking in this way, so this again becomes the anterior of the left lung, and the posterior will be at the back as the posterior surface. So we have to understand that while we are drawing in a diagrammatic view, to remember, we can easily remember in the way that anterior of both the lungs will be close together, and it's logically the right's posterior segment will be of more right, and the left's posterior segment will be in the more towards the left. Now, the inferior lobe. The inferior lobe's superior segment will be at the topmost, as the name suggests, the superior. Now, the remaining is the basal. Okay, of both the lungs, the superior and the basal. Again, for the basal, this will be the anterior most. There will be the anterior most, there will be the posterior most, there will be the lateral, and there will be the medial. So the medial is not shown because the medial is towards the medial aspect of the lungs, so we can't visualize it from the lateral aspect. So the anterior basal will be in the front. Okay, so anterior will be towards the front or the middle. Always the medial things or the anterior things will always be in the middle. This is a golden rule, kind of. So anterior basal, then comes the medial or the lateral, but medial is not shown, that's why the lateral basal, and consequently the posterior basal. Okay, so this is how in the left lung too, the anterior towards the medial, and then the lateral and the posterior. Okay, now about the middle lobe. So obviously the medial, which is also called the inferior lingual, and the superior lingual is the lateral, and consequently this is the lateral. Now about the numberings. Always remember the apical is always the first. So that's the normal thing. The topmost is present for the first of the apical. Then there is this posterior, which is while we have to remember in this way, while we are talking about the segments in the superior lobe, it's always from back to front, like apical, after apical, then posterior, then anterior. And while we are in the inferior lobe, we have to talk in this manner, like medial, then to the most posterior, like that. Like then seventh, that's the medial, then anterior basal, then again towards more back and lateral basal, then posterior basal. Similarly, anterior basal 8, and the medial, like we are talking about the medial basal 7, then anterior basal 8, then 9, then 10. Like after apical, we are always giving the position 1. So after 1, I am talking about the posterior, which is at the back, the anterior 1, 2, 3, and then 4, 5 I will be talking about later. Then 6, the superior, obviously like 1, the first position. Then 7th, from 7th I am coming like this way, 7th, 8th, 9th, 10th. 7th from the medial, then anterior, then lateral, then again posterior. 7th, 8th, 9th, 10th. And this remaining middle lobe, 4th and 5th position. 4th will be again the lateral. Again we have to remember 4th is always the lateral. This is a thumb rule. 4th the lateral, and medial or the inferior lobe is in the 5th. This is how we can remember the bronchopulmonary segments easily. 1 posterior anterior, 1 posterior anterior, 1 2 3, 1 2 3, then 4 5 lateral medial, like posterior only, 1 2 3, then again posterior medial, 4 5 posterior medial, like superior lingual, inferior lingual, then again 6th from top again, 6th, 7th, 8th, 9th, 10th, 6th, 7th, 8th, 9th, 10th.